My name is Dr. Kath Benfer, Senior Researcher at the Queensland Cerebral Palsy Research Centre at the University of Queensland. On behalf of my co-authors and community partners, I share the article, Early Detection of Infants with Neurodevelopmental Concerns Indicative of Cerebral Palsy in a Lower Middle Income Country, India. Cerebral palsy is among the most common and costly of childhood physical disabilities. Early identification of infants at high risk of CP in the first year of life is recommended based on high quality evidence in the International Clinical Practice Guidelines. This ensures infants can be fast-tracked to receive targeted early interventions during a period of rapid neural development and plasticity. With over 80% of the global burden of cerebral palsy in low-income countries, a later diagnosis and numerous barriers to accessing intervention, there's a significant need for low-cost, accessible and scalable early disability screening models for these contexts. Both general movements assessment and Hammersmith infant neurological examination are among the most predictive tools. They are objective, quick and easy to administer, offering low-cost means for regular surveillance. The current study implemented these two guideline-recommended screening tools in community and hospital settings in West Bengal, India. In a very resource-constrained setting, our study aimed to determine the tool reproducibility and the diagnostic accuracy of screening to identify neuromotor concerns indicative of cerebral palsy. This prospective study was nested within an overarching randomised controlled trial of the LEAP intervention that was published in Paediatrics in 2024. It was conducted in vulnerable, low-resource communities within West Bengal, including urban slums in Kolkata, a tertiary government hospital, and a rural non-government organisation. To be eligible for the LEAP screening program, infants had to have one or more birth or infant detectable risk factors and be aged 12 to 40 weeks corrected age. Infants were screened high risk of cerebral palsy if the general movements assessment fidgety period result at 12 to 17 weeks was absent or abnormal fidgety, or scores on the HINE were below the published Romeo CP cut points for infants aged 18 to 40 weeks. General movements videos were collected by trained community workers and HINE examinations by trained local community coordinators. Neuromotor concerns indicative of cerebral palsy were classified at 18 months by a physician from a videoed neurological examination and a semi-structured movement protocol. 834 infants were referred, with 785 screened, half on the general movements and the other half on the HINE. 2/3 of these infants were screened at less than 6 months, with a mean age of 22 weeks. Almost all of the assessments were rateable on the general movements or the HINE. 18-month outcome data was available for 175 infants based on the scope of the study, and this subsample was used to calculate the diagnostic accuracy of the screening tools. 1/5 of the infants screened were classified as high risk of cerebral palsy. The inter-rater reliability between ratings was excellent, and we found 80% accuracy of these tools for predicting neuromotor concerns indicative of cerebral palsy. The HINE alone was the most predictive tool, and outcomes were more accurately identified by the screening program conducted in the hospital. This study provides support for use of the guideline-recommended screening tools in low-resource settings to reduce the age of identification of high risk of cerebral palsy to less than 6 months. Local clinicians were able to implement the screening program with fidelity, following access to globally recognised training from expert trainers and support from experienced raters during the implementation. Delivering the screening program through local community members for free and in the home enabled equity and access to evidence-based screening and fast-tracking to earlier interventions and family support.